Hi everyone. So I wanted to do a quick video about the struggles of being in nursing school. So far I've completed 1 year of nursing school, and the struggles that I have dealt with was one, not knowing what to expect on certain professors or certain exams, and then adjusting to certain exams and certain quizzes and questions and stuff like that. So that was the first struggle. It took me a while to get over my first semester because there was so much information and I was just going through everything, not knowing that all I had to do was just study off of the slides. That's number one. Number two, the other struggle is that all nursing schools teach clinicals or skill wise differently. My nursing school, I feel like they weren't strong in when it comes to teaching skills, nursing skills. I think the only thing that I remember from my skills was catheter care, how to operate an IV pump, and trach. They focused on those three a lot, and then they mostly made us watch ATI videos to teach us how to do certain skills, and then they told us to come to lab and practice. That's all. So some of the professors in the lab, they might just you know they let you be in charge and you do stuff, and they sit back. So that's another struggle I had to adjust to because I'm used to people like having certain things organized, and then they teach you. But luckily, I took a CNA course before I started nursing school, so I kind of know some of the bedside nursing stuff that you have to do that nursing school was supposed to teach you on your first semester. But mine's they expected us to learn from ATI videos. So that's the other one. A third one would be um, mental health wise. So like you compare yourself to people all the time. I have a friend who constantly asks me, "Hey, what did you get on this exam? How did you do on this exam?" So I compare myself to her, or like assignments. You see your grade and you're like, "Oh, I didn't do so good on this assignment." And then you ask someone and they do better than you, and you're just like, "I worked on it for a whole week. Yeah, I did worse than someone who worked on it last minute." So that right there is another thing that I struggled with a lot. And then also asking for extensions. Like, I'm the type of person, I don't ever ask professors for extensions, but I did it this fall semester for one of my assignments, and I did so well, and it decreased my stress so much because she gave me an extra week. So I guess that's an important thing to do in nursing school. And the last one I would say would be feeling that you're not learning much, or you're not as compatible as other people, or you're not smart enough to be in the program. Because I have a lot of people, so my program has 31 people in there, and like majority of them work as a PCA. So when we would have conferences or huddles after our clinicals, the professor would talk about certain diseases, or she would talk about certain problems or health issues, concerns, and then there's some people, they would reply. She talks about some medications and people would answer it, and I'm just sitting there like, I don't know what you're talking about. So like comparing yourself to those type of people, because most of them might have like family members or relatives who were already in the healthcare field, whether it's a nurse or a, a physician, or like a CNA, or someone that they're related to, or just them being in the healthcare field for forever, 8, 6, 7 years, helps them have so much knowledge that you're just looking at them like, wow. So I think that's all the struggles I had in nursing. I'm pretty sure there's more, but those are the only ones I could remember or I could think about. And also, I think that's all. Bye.